Okay. So, good evening to everyone who has joined us today for the KSOS YOSI York webinar series. As you all know, we are running a webinar series on the FAICO exams, which is one of the most popular exams nowadays. So, this one is the third of the series and it is focusing on glaucoma. So before we start, I would like to extend my heartfelt thanks to Dr. Bastin sir, our scientific committee chairman, the governing council members of the Kerala Society of Ophthalmic Surgeons, and the governing council members of the YOSI Society of India for their steadfast support in helping us to give a platform where all the young ophthalmologists can learn, teach, and grow together. So as we all know, FAICO exams started by All India Ophthalmological Society in the year 2010, and it has been gaining popularity since then. So it has exams in all the specialties. And the most important thing about FAICO exams is this gives a uniform platform for all of us to gain knowledge, for implementing a common practice pattern, and for strengthening our CV. Another big boon to this exam is all the exam centers are accessible to all of us, and it does not come with hefty price tags. The fees for this exam is only 10,000. So if anybody is in a dilemma whether to give this exam or not, go forward regardless of the age, regardless of the experience. Please go forward and give this exam. And I hope today's webinar will guide you on what to prepare for the theory exams and how to face the practical exam, which everybody is in a dilemma of what to prepare for this FAICO exams. So today we'll be having first Dr. Anima will be talking about the theory part, and then Dr. Arshi will be talking about the practical part. And in this we have a great set of experts who have all cleared their FAICO exams, and they will also share their experiences during their exams, and also they will give us tips on how to prepare this exam. So now I'm just let me introduce Dr. Sweta to you. Today's moderator for this session is Dr. Sweta K, an upcoming promising and talented glaucoma specialist from Kerala. She is currently working at Jyotis Eye Care, Kannur. So Dr. Sweta will be moderating. And I'm handing over to Dr. Sweta from here. Let's start the session, and I hope this session will be very useful to all of you who are spending their special evening with us.
Thank you, Raki. Warm good evening, everyone. Thank you, Raki, KSOS, and UC team for this opportunity. It is my privilege to welcome you all for today's webinar, and we are very fortunate to have eminent speakers with us. I'll just share my screen. Okay. So this is the third of this third of the series, which deals with the FAICO exams made easy part 3, subspecialty glaucoma. And I would first like to introduce our panelists for today. We have with us Dr. Thomas Arun Varghese, who is a consultant glaucoma and neuro-ophthalmologist at Dr. Jacob Eye Care Hospital, Cochin, Alfonso Eye Hospital, Pala, and Todupura, St. Joseph Eye Hospital, Kanjirapalli. Dr. Thomas Arun sir is one of the first recipient of the FAICO glaucoma, which was conducted in 2010. He was one of the two who was awarded with the degree. I would like to warmly welcome you, sir. You. Next, we have Dr. Mainak Bhattacharya, who is the medical director at Glaucoma Services IQ Super Specialty Eye Hospital. He has, sorry. My screen is on. Is my screen visible?
Yes, it's visible.
Yes, Sweta.
He has more than 30 peer-reviewed publications with 600 plus citations, 3 book chapters, and more than 75 presentations in national and international conferences. And he is a recipient of FAICO Glaucoma Award in 2020. We welcome you, sir. Now we have...
Thank you, Dr. Seth. Thank you.
Third, we have Dr. Midhun Tulasidas, who is a cataract and glaucoma specialist at Trinity Eye Hospital, Calicut. He did a fellowship from Shankara Eye Hospital, Coimbatore, Center for Sight, New Delhi. And he's a gold medalist in FAICO Glaucoma 2024. And he has authored over 80 publications, written 8 book chapters, and presented more than 65 papers at conferences. And he has several awards to his name. Welcome, Dr. Mithun.
Thank you. Thank you. It's a pleasure to be here.
And we have Dr. Janie Joseph, who is an associate professor, glaucoma and cataract surgeon, Amala Institute of Medical Science, Thrissur. She has done her fellowship in glaucoma from Comtrust Eye Hospital, Calicut, and she is one of the recent FAICO awardee 2024. Welcome, Dr. Janie.
Thank you so much.
And we have Dr. Vishnu Devraj, who is a glaucoma cataract surgeon at We Trust Eye Hospital, Vadagara. And he has done his fellowship in glaucoma from Comtrust Eye Hospital, Calicut. We welcome you, Dr. Vishnu. And we have our speakers for today, Dr. Anima VN, who is presently a consultant ophthalmologist and glaucoma specialist at Vasan ASG Eye Hospital, Visakhapatnam. And she did her MBBS MS at Amrita Eye Institute, Kochi, and fellowship in glaucoma at Comtrust Eye Hospital, Kozhikode. And she has received a FAICO glaucoma in 2024. Welcome, Dr. Anima.
Thank you, ma'am.
And we have Dr. Arshi Singh, who is an assistant professor at glaucoma services at Guru Nanak Eye Center, Maulana Azad Medical College, New Delhi. She is a young active YOC member who is a team leader of YOC Glaucoma Focus Group, executive member of YOC, managing editor of Yo Time, and she's also an assistant editor at Delhi Journal of Ophthalmology. Welcome you, doctor. We would like to hear more from you.
Thank you so much for having me here.
Now, so this exam, it can be a milestone for many young ophthalmologists, and we all know that right guidance make all the difference. So now, without taking much time, I would like to invite Dr. Anima for the first part, that is how to prepare theory of FAICO glaucoma. Over to you, Dr. Anima.
Good evening, everyone. I would like to thank KSOS and UC for giving me the opportunity to present my topic on how to prepare for the FAICO glaucoma theory exam. I will be sharing my preparation insights with all of you today. I'm audible, right?
Yes, ma'am. Clear.
Okay, ma'am. So why FAICO glaucoma? So it is awarded by the All India Ophthalmological Society, and it provides academic recognition. That is, it indicates that you have an expertise in the subspecialty. And for career advancement also, it is important because it strengthens our CV, especially when we are applying for teaching institutions, and also when we would like to apply for international fellowship programs. It enhances our clinical confidence, and also improves continuous learning skills, because we have to provide the best of care to our patients. So we make ourselves updated about the recent treatment protocols in the subspecialty. And it also provides professional credibility, because your colleagues and the patients will recognize you as a subspecialist who is having expertise in the field. And also it provides networking opportunities with subspecialty consultants throughout India. Now, understanding the exam. So the theory exam is an online MCQ exam with 100 questions of 2 hours duration. There is no negative marking, and the cutoff mark is 70%. The options for the MCQ exams, you have to be really thorough with the subject, because the options can be really confusing also at times. So we have to be really thorough with the subject. And the syllabus for the exam is as per the revised curriculum for subspecialty programs in ophthalmology, which is available in the AIOS website. It is freely available as PDF, and it provides the detailed topics which we have to go through for the theory as well as the practical exam. Now coming to the study resources which I used. So mainly it was American Academy of Ophthalmology, the Basic and Clinical Science course, the recent edition. The book by Professor Dr. Ramakrishnan, the Diagnosis and Management of Glaucoma, Shields textbook of glaucoma, and also the IGO edition with the recent review articles from 2017 to 2022. That was also useful in the preparation because we get the up-to-date knowledge of the topic with the recent advances. And also Kansky for the pictures mainly. And the AO ophthalmology, it has got MCQs at the end. So that is almost similar to the pattern of the exam. So the AO MCQs also helped. And you can also go through the previous editions of the AO Basic Sciences of Glaucoma. So that also has MCQs at the end, which we can use for preparation. Now it is the era of e-learning and there are many online platforms available. So I had used the American Academy of Ophthalmology, the One Network. So if we are AIOS members, we can log into the One Network, and that has self-assessments in the subspecialty with the MCQ, which we can practice the MCQs there. And also the iFocus lectures, because many a times we will not be able to read the books to read the textbooks to a deeper extent. So these iFocus lectures freely available in the YouTube was of great help, because we can hear it especially during the OPRs when we get some time in between, when we are having exercise, when we are doing exercise, that time we can listen to the iFocus lectures. And also the iWiki also have articles. So that is also helpful in my preparation. Then the Iowa Glaucoma curriculum, that also contains lectures by Professor Wallace Alward. And also Telegram. Telegram has a lot of channels with MCQs, and Glaucoma channel has got many PDFs. So that was also useful. Now the study plan, we have to have a strict timeline for the preparation. Mostly about 4 to 6 months is what I planned. And daily, you have to set daily and weekly goals, like what are the topics you will cover each week. And we have to balance clinical work and study hours. So these online resources were really helpful in that aspect. And use of active recall and spaced repetition. That is, it is very important to revise through the topics. And avoid resource overload. So all these resources, sometimes we may not be able to go through all the books. So you can stick to one book and you can go through the topics, and you can also practice MCQs related to that. So, and always revision is also very important. Now, these are the topics which are of focus in the exam. Basic sciences, you have to be thorough with the anatomy of the angle and the optic nerve head. Then regarding aqueous-humor dynamics and corneal biomechanics, also you have to be thorough with the biochemistry of the aqueous humor, then the embryology part, and also the genetics. Tonometry, again, you have to be thorough with the principles and the different techniques, like Goldman applanation tonometry, which is the gold standard, factors which cause errors in the IOP reading, like central corneal thickness and astigmatism. Then indentation tonometry, then also the tonometry techniques which are useful in certain cases. Like Pascal DCT, it is more useful in patients who have undergone refractive procedures. And also this rebound tonometry is useful in children. So all those specific areas where each technique is useful has to be studied. And also the recent advances like pneumotonometry and triggerfish contact lens sensor, which is used for 24 hours IOP monitoring, is also important. Now, regarding the angle assessment, you have to be thorough with the gonioscopy, both direct and indirect gonioscopy, the theory part of it, and also the normal and pathological findings. Then the UBM and ASOCT, the difference between both the techniques, and all the classification systems like Schaffer, Spaeth, and ITC index. Then optic nerve head and imaging, we have to go through the clinical discharges in glaucoma, the how to differentiate between glaucomatous and non-glaucomatous cupping, and also the OCT, the different machinery available, and the RNF, the artifacts causing erroneous interpretation in the OCT. So all those can come as clinical scenarios, and MCQs can be based on that. Then regarding the perimetry, we had questions regarding the different the threshold strategies, like in each, like 24-2, 24-2C, 10-2 HFA macula. We have to know how much the different points tested in different strategies. Then regarding progression analysis, both event and trend. Then regarding the recent advances like microperimetry, frequency doubling technology, all those questions can come. Then also regarding the clinical features of the different types of primary, secondary glaucomas, the treatment which is given has to be studied. The medical management also, the different anti-glaucoma medications, the mechanism of action and the side effects and fixed combinations, and the newer drugs like Rho kinase inhibitors and nitric oxide donors, and the sustained drug delivery systems. Now the bimetoprost implant is there. So these also have to be prepared. Now, lasers in glaucoma, they can ask you about the different lasers, like for YAG peripheral iridotomy, argon laser trabeculoplasty, selective laser trabeculoplasty, micropulse laser trabeculoplasty, and cyclophotocoagulation. We have to know the wavelength of the lasers used and also the settings. And regarding the surgical management also, there will be, you have to go through the topics in detail, like trabeculectomy, the technique, then the complications associated with that also has to be studied. And the questions also you have to read carefully, because otherwise we will miss out the question. We will not be able to give the answer correctly. And also study the glaucoma drainage devices, the different types, valve, non-valve, and also the recent advances like the iWatch. Then a non-penetrating surgery, and also we have to cover regarding the new mixed procedures also. Then also the special cases like glaucoma, normal tension glaucoma, where the ocular blood flow comes into play. So that has to be studied in detail. Then the non-IOP risk factors for glaucoma progression, and then pediatric and congenital glaucoma, glaucoma in pregnancy, and systemic diseases, which are the drugs which can be given during pregnancy lactation period, and also the neuroprotection strategies. The clinical trials are very important again. So we didn't have much of questions for this from the MCQs, but mostly it came for the practical exams. So all the clinical trials, we have to know what is the type of the study, what are the results of that, and what are the clinical implications. Now, this is very important. We have to, because many resources are there. As I told you, this resource overload will again make us confused about everything. So we can read up from stick to one particular textbook, and you can prepare notes from that. And you have to keep on revising. So we can make mind maps, flowcharts. And as I told you, the Iowa glaucoma curriculum has got flashcards, Anki flashcards, which again you can go through during the free time. It will give you points. And also we can make mnemonics to study, make it memorize better. And like drugs in glaucoma, you can make tables and like MCQs, you have to practice through many MCQs. So whatever source of MCQs we have, even if it's for the FAICO subspecialty exams also, you have to practice through that. Now the exam day strategy, we have, as in every exams, we have to sleep well before the exam and eat healthy. And because the MCQ exams is for 2 hours and the time it's 100 MCQs, we have to allocate the questions accordingly. So easier ones we have to do it fast, and any questions which we have doubt, we can keep it for the last, and we can return it to it and answer it. And you have to keep calm and answer the questions. Now, take home lessons, you have to start early. You have to keep on revising in between and focus on the understanding and how it is applied in the clinical scenario. And you can be confident about your preparation. Thank you.
Thank you, Dr. Anima. That
Thank
was an excellent session, very well structured and informative. Now I would like to move on to the panelists. Let's hear their experience, how they prepared. First of all, Dr. Arun Thomas, sir, you were among the very first to clear the exam. Could you share a bit of your experience preparing for it back then? Do you feel that there is a difference between the way exam was conducted then and way it is now? Over to you, sir.
Thank you, Dr. Shraddha. Thank you, KSOS, for the opportunity. Yes, nowadays, I mean, I did not have all these, online material that you all have now. So actually now it's really quite good. I mean, there's an overload of material. So that at my time, I just used mainly the MCQ books. I had just completed a fellowships in glaucoma fellowship from UK in 2008. And I wrote this in 2010, the first FAICO. So mainly textbooks, and of course going by the from the practical experience also, because that also is important for the practical exam. So theory mainly from the textbooks, and also online there was some. There's Chua, Mr. Chua has his website called mrcof.com, which I use for preparation for my FRCS and my MRCOF exam. So those were the main materials I used. Thank you.
Okay, sir. Thank you. Now, Dr. Vishnu, we would like to hear your experience in preparing for your theory, saying that you are the one of the recent, you have cleared in 2024. So would you like to share your experience?
Good evening, everyone. First of all, let me thank everyone for giving me this opportunity. Basically, since I was working in between, I didn't have much time to prepare. So what I did was I stuck onto one single textbook, and any doubt I had to use reference as Beckers and Schaefer's, and um, basically I studied AAO, basic science only. That's the book I followed, because most of the things we have seen during our clinical time during our fellowship. So I stuck onto one single book. Whichever queries I had, I followed the iFocus like Dr. Anima told. Some part of HFA and OCT RNFL, I followed the iFocus videos as well. And regarding theory part, there was some among the whole questions. The question pattern was more like choose the best answer. Sometimes you actually get confused. It's like choosing the best answer. And some questions which I still retain is there were some questions regarding the clinical trials actually. In fact, TVT studies came around 3 questions, and some questions overlap with that of the genetics, especially that of primary congenital glaucoma, and some part of PAX gene was also like around 3-4 questions which overlap with the congenital glaucoma and genetics also came. And regarding practical, but there was 2 stations. My center was actually at Shroff Eye Hospital, Delhi. So I'm not sure if there is like region-wise there is a question pattern difference or not. But because I gave a theory exam at Kolkata and my practical was in Shroff. So we had 2 stations and there were 16 candidates, and among them the examiners were actually Devan Tulli sir, then like they are prominent actually there. Then actually there were 2 stations, and among the stations there were 16 candidates total. So they told that there won't be any practicals because they expect all of us to be well versed with the techniques. So instead they give OSCEs, and each OSCEs were given sub questions around like 4 questions, so that we will be able to clear at least half of that. It was structured in that way, but I think it may vary from center to center. I'm not sure regarding that because then in one station they mentioned about they will give a clinical scenario, and they've given a sometime for example for me they gave a like an HFA perimeter report and told me to interpret that. And after that, how will you manage? And they give us, this patient is so and so year old, and he has this comorbidities. How will you manage and how will you follow? This is what they gave us regarding perimetry. And in perimetry, they went to up to GPA, event analysis, trend analysis, and they ask questions regarding that. And another scenario was like post-trap patient with a B-scan report, and what was the diagnosis? How you manage? It was actually suprachoroidal hemorrhage, and how it went like that. Then they gave multiple. These were the two questions in one station, and second station, it was actually one. They gave more of like pictures, image based questions. Like they showed a picture of iris cyst and asked how we will manage that and what would we give. And one another question was compression sutures, and told me to identify what this and which condition. And another questions were regarding drugs specifically, like bromidine, why, like contraindicated, like age group, like old age group or children, why, and whatever answer we give, they expected us to give the reasoning why we are doing that. More than the answer, they are actually focusing on what is the reasoning of that, why you are giving that.
Okay,
And
thank you. I think I would move to the next panelist. Dr. Mainak, how did you balance the exam preparation with your regular clinical practice? Did you rely more on textbooks and online resources or more into case discussions? I want to know about the theory part, the preparation of the theory part. Dr. Mainak?
Yeah. Good evening, everyone. Thank you, KSOS, Dr. Shweta, and Dr. Rakhi for the opportunity. I think Dr. Anima has presented it very nicely. One thing is there that because of the availability of the like the syllabus now online from AIUS itself, the things have got more standardized. At our time, we always used to get calls like in the like coming subsequent years also from a lot of juniors as to what is the syllabus, because there is no limit to the syllabus, but now they have actually quantified. That is a good thing. So in our times, what I like, it depends on what stage of your career you actually undertake the FAICO exam. So I had finished off my senior residency and I had just joined as an associate consultant at a place. So obviously with your practice, you do not get that much of time. So I felt that if you can stick to whatever text you have already followed in your residency or your fellowship, so if whatever text you're comfortable with, you can brush up your basics. I think that helps a lot. And in addition to all the resources which Dr. Anima has pointed out, one was an AIUS handbook is there, in which they have it like syllabus wise, like specialty wise, and also the CME series of the AIUS has been brought out multiple times on different specialties, but the ones which cater to glaucoma, these are two additional resources I can say which can help you prepare for the theory exam. And I would say the theory exam in our time was a very was a mix and match of the questions which are of the basics and anatomy and of the clinical situation. And as Dr. Vishnu has pointed out, those questions which cater to the clinical situation can be tricky and they can have a subjective answer. They don't have a single best answer. So I would recommend that those who are going for the preparation, the numerical questions and the factual questions, they should try to score more on those questions because there will definitely be some questions which have their gray areas and which do not have a single best answer. So for which doing a definite preparation is difficult, I think.
Thank you, Doctor.
Thank
That is true. Actually, we have lots of questions where we get confused, which is the correct answer, and we keep thinking which among that is true. You have to just choose whichever is best answer. Now, Dr. Mithun, you were awarded the FICO Gold Medal, which is truly an outstanding achievement. Could you share what strategies helped you reach that level of performance? So what is the difference between simply clearing and excelling it? Dr. Mithun?
First of all, thank you, Dr. Rakhi, UC, and KSOS for having me here. Am I audible?
Yes.
Yeah, so I didn't prepare much, like all the topics are told actually. So I have given my FAICO when I have finished my fellowship actually. So like you all know, like during fellowship days, you won't get much time to actually prepare for the exam. So what I understood was like when you see the pattern of the questions, like out of 100 questions, almost 50% of the questions were just basics. So I think even a postgraduate can answer 50% of it. Now the remaining 30%, I would rate it as like kind of moderate, where definitely you need a kind of fellowship training. And yes, of course, 20% were little recent advances and trials, which you can keep it as challenging segment. So actually scoring 70% is actually possible. And most of us don't know what we actually scored. So I don't think the theory marks actually make a difference. So what I understood was basically I only followed two basic uh, not textbooks actually. Like I just followed American Academy of Ophthalmology modules. That is one thing which I actually just looked at in the evenings. Second one was the iFocus series. So these were the two things which I actually looked at. So like Anima currently pointed out, like iFocus series is like a truly a blessing because you can just listen to it when you're driving or when you're doing some other work. So you actually need not sit and read. And MCQs definitely, AO MCQs definitely help. The only thing is when you're reading these questions, you should have an idea like how the next set of questions will come. So like suppose if something on a newer implant has come, then obviously you have to go back and look for other newer implants which are recently launched or something like that. So that gives you a little upper hand, maybe I think, or gives you a better picture rather than just mugging up the question. So you will actually get a pattern when you follow the AO MCQ. So you can actually follow the pattern. And yeah, I think nowadays, like when I was in Delhi in 2018, it was actually very difficult to crack FICO. But I think since 2023, like since 2, 3 years, it is fairly easy to crack because they have restructured the exam pattern. Like Arun sir has told, like initially, if you look at the pattern, maybe 2 or 3 get selected per specialty. But nowadays we have almost 20 or 30 candidates getting selected per specialty. So they have actually restructured the exam pattern. So even who are freshers or those who have actually taken a long time after their fellowship, still they can actually apply for FICO because nowadays they have made it little more standardized so that I personally feel it is relatively easier to crack now than it was in 2020, means before COVID, maybe I would say. So initially it was actually tagged with FICO. Like in earlier days, when you actually get the FICO degree, you will also get an FICO degree in subspecialty, but now they have just taken it off. So definitely it is worth trying because all of us might have done fellowship training from different institutes and we just add these letters, FAH, FSCH, and now we have something very standardized that actually gives us more credibility and more visibility that like how we say DNP or MS degree, like we are under one particular society and all of us are recognized as glaucoma specialists. So there is nothing like a specific preparation from my side for the theory part, but yeah, for practical, I would discuss it after the practical talk. Thank you.
Thank you, Dr. Mithun. And Dr. Jaini, can you share your experience in the preparation and challenges you faced?
First of all, I thank you, Raki and Yossi, for Dr. Shweta for giving me this opportunity. And regarding the theory exam, actually, Dr. Anima has elaborated very well regarding the sources of where to read and what to read, actually. But the basic thing is that we should go for this repeat reading is very important because in the last exam, actually, I saw the thing was around 20 questions were just only for the numbers. The questions were like, for example, the wavelength of this laser, what was the wavelength used for SLT, what was the wavelength used for micropulse. Again, the magnification factor of the lenses, what is the volume of the aqueous humor, or whether with millimeter like that and all, so much where we get so much confused there. And also the area of the GDD was also asked, Ahmad Val, the clear path. Each areas were given as multiple choice questions and actually we were confused with those numbers. So these numbers questions, I think 20 of them were actually so confusing where we will get those only if we go for this repeated reading is very important there. Now, after the 20 questions, then I saw the 10 questions usually comes, it was from the recent advances. So the recent advance portion is actually also very important. Again, there we should go and refer again, and we should at least keep 1 week or something there for the recent advance because usually the 10 questions were there for the came from the recent advances. Then the rest, as the Dr. Mithun has told, about the 50 questions were okay. Then the rest of the questions again, if you are practicing glaucoma, you will be able to answer it. Some clinical scenarios and the other part of the exam is that about 40 questions were all except. So that is the important thing there, because only one will be not the answer. You should try to find out. So again comes there the repeated reading and the understanding regarding all the sources what we have seen. Will cover and will make us more familiar with those questions. So understanding the pattern and again studying to the point will help us to clear out the exam. Thank you.
Thank you, Jaini, for this perspective. And Dr. Arshi, can you just share your experience in preparing the theory part?
So I think Dr. Anima has actually covered everything really wonderfully. My experience was I have my senior here, Dr. Menak. He was one of the people who guided me about how to prepare. It really makes a difference about who tells you how to do things. And these webinars are very helpful in that regard. People who don't have seniors in the same specialty, they can actually just watch this and come to know about everything. So what I did was I went along as I had finished my senior residency when I gave the FAICO exam. I think it makes a difference about the timing. As Dr. Mithun was saying, things have changed now, but it I think is easier for a fresher because you're more thorough with your theory right after you finished your glaucoma training or while you're pursuing your glaucoma theory. So at that point of time, you actually know all the theoretical things much clearer and you're not just ingrained in the practical aspect of the disease. So that really makes a difference. And as far as my preparation went, I read a lot of books, I read articles, and I actually had a lot of fun reading. So for me, it was more about, building onto my learning rather than just cracking the exam. After a while, it was like, I don't care if I don't crack this, but I'm so enjoying the process of getting to learn more. I think that really helped enjoy the process. So I would read every night for almost 3 months before the exam. But it is primarily the last minute revision that you do that helps you with the numericals and the trials and those sorts of questions that you get. That is something which is extremely important because those MCQ options are very close together. So you'll have 0.23 and the other option will be 0.32 or 0.24. And you'll have to, just boggle your heads about which one it was. But yeah, we had a lot of theoretical questions and there was a lot of, there was embryology and anatomy as well, which I think is what you start off with. And Dr. Ramanjeet's book is also something that one can read. It depends on whatever book you've read for your theory during your post-graduation. If it's Shields or AO, you just go back to that same group and book and just supplement. Thank you.
Thank you, Doctor. And for me, I had cracked this exam in 2021, same as what Dr. Mainak had mentioned. I didn't have any online, no webinars like this to guide us. So for me, my senior, Dr. Prasanna Venkatesh, was the one who was guiding me. I was actually I used to listen a lot of Iowa videos. We have 50 videos in that Iowa website. You go to gym, wherever you go, you drive, you just keep it on. You can just keep on listening. The basic book, you follow one book, but then listen lots of videos that will keep on, it will help, really help. I was also enjoying I did my, I cleared the exam just after my 2-year fellowship. And once we give this exam, it gives us a confidence that, okay, we have learned in our fellowship. That is also important. So next, we'll just move on to the next session. That is how to prepare on the practical part. Over to you, Dr. Arshi Singh.
Yes, I'm sharing my screen now. Just let me know if it's visible.
Okay, it's visible.
All right, perfect. So as my task is already easy because Dr. Anima has told you everything, I thank KSOS and Yossi for this opportunity, especially Dr. Rakhi. Thank you for having me here today. So we'll just be discussing about what the practical is like, what the instructions are for what you have to plan for your travel, and what the exam format is like, how the assessment is done, and again, a brief overview about how to prepare for it. So this is the kind of letter that you get. You usually are informed about your practical around a month or 1.5 months in advance about where your venue is. So the moment you get is make your travel plans. These are the instructions that come from AIOS that you get all of this. It's very minimal, basically because they've done away with a lot of clinical examination So it's just OSCEs where you have theoretical stems. So that's all you need to carry with you. You don't need your instruments anymore. But it might change over time. This is what it is for right now. This is how it's been post-COVID. So exam format is usually, this is for 200 marks. And I think the gold medal actually depends on how well you do your practical rather than your theory. Your theory needs to be passed before you can actually appear for your for your practical, but your gold medal depends on the marks you score here. So it's OSCE and Viva of 100 marks each. And the basis of the evaluation is how you are how your skills are, what your clinical judgment is like, how your knowledge is, and how you reason it out, and your problem solving ability. So that is how all the questions are also geared to be, especially the OSCEs. So before I start, again, like as I said, learning is fun. Make it fun. This is one of the exams that you're studying for your qualification, but also because you want to be an excellent glaucoma practitioner. So learn from as many resources that you can. This is one opportunity to grab hold of those books that you haven't read, or those articles that you haven't studied, or those videos. So, and your theoretical part, because you've already covered it before you come to this exam, so you're already, you have a holistic view about what the exam pattern is going to be like. So you don't need to start from the basics because you've already done the theory. So you now just need to polish the practical aspects of things. So usually the OSCEs that they give you are 10 questions. It's time. So they have a timer there and it's 5 minutes each. They will give you a sheet. You don't need to bring it. And usually you have a clinical scenario which might have a stem with multiple sub-questions. They might have an image-based or a video-based or just a theoretical question in which they can ask you anything about the condition. So it will be leading on to those the diagnosis or the investigation, or what do you think should be done next. So it can be something that is a little subjective or something that is very straightforward, like mention 2 complications of this condition or mention 2 side effects of these drugs. Or it might be an image of a new device or a new drug or a newer investigation modality, or it might be concerning some newer advance. You can also have questions on statistics like odd ratios. They might tell you what is alpha error so that they know that you are able to assess your journal articles well. Other thing that can ask you is historically the important trials. They can have questions on that. Usually this is part of the Viva, but you may also have a OSCE on this. You might have questions related to scientists and the procedures that they've discovered in the past, or procedures that were done in the past and are not followed anymore, and you might have an image regarding it and a question about it. So as I said, OSCE, just to understand what OSCEs are like, these are the various different books that are available. They're mostly for postgraduates, but you have a lot of glaucoma questions in here as well. And you can have a look and also prepare. Besides that, there are multiple videos online with YouTube, in YouTube, especially iFocus also has one in UOC, about how OSCEs can be prepared for. So one thing that you can do is go through those. Then the table Vivas. So it usually varies from which center you're at. They try to cover these very same aspects that I'll be discussing right now, but you might have 4 tables or you might have 2 tables, but usually there are 4 examiners, and in which 2 are internal, which means whichever center that you get, 2 people will be from the very same center. They'll be glaucoma specialists, and 2 people will be traveling from other quadrants of the country. So if your centers in the north, there'll be someone traveling from the south or someone traveling from the west. So you'll have 2 people from 2 different geographical areas. And these are the 4 examiners who take your table vivas. So first, usually they start off with the OSCE session, and thereafter they do your table vivas. And they give you a smart break in between as well. So what they usually ask in table vivas is something that we used to have in our postgraduate exams as well. It's going to be about your drugs. You can have the drugs kept there, or they can have images of them. You can have the newer drugs that they might have, and the surgical instruments. You have a separate instrument viva in which you can have the implants also being kept there, including the intraocular lenses actually. And you also have lenses in terms of the gonioscopy lenses and the Catina lens, or whatever that you use for therapeutic measures. And your viva then goes on to about those procedures, about how you perform the SLT or the ALT or the suturolysis. Then you can have clinical invest. This is something that is a major part of your vivas. It takes time. So they usually have a computer in which they have images, or they might have a folder with these pictures of investigations or radiology images, and they will, depending on your answer that you give, they will ask you your reasoning as a Dr. Vishnu was telling right now. So they want to know about how much you know about the subject and why you think guide you forward into what they want to ask you. Then they can also ask you about trials, or they can show you video clips of surgeries, of a step of surgery, stop you right there, tell you what should be next, what is being done wrong. It might be something that's an error. It might be something that's absolutely the perfect way of doing it. It might be a complication and you'll have to identify those things. Or rarely you might have pathology specimens like in the older colleges, they might have eyes of ophthalmos or things like that. And you might have also microbiological images or media, for example, like for valves, when we use those cornea or the sclera, so they might ask you about the media as well. So, discussing about this in detail, these are the various recent advances. Dr. Anima has already covered most of these things, but these are the things that were there in our exam. We had these images or these devices that were kept, and they were just handed to us, and we were told to identify and discuss them. And these are the trials that you definitely need to go through. And besides the trial, I would honestly say that you should flip through your journal, especially the Journal of Glaucoma, AO, Canon Glaucoma Practice, and IGO as well. IGO had a glaucoma related issue last year. They had subspecialty issues, and those really help to know about the recent advances. So these are things that you can enjoy reading. You can just, have a look at them a couple of weeks before your exam. These are various online resources. These are two specific Wikipedia, iWiki articles that I would say are very useful because they give you a summary, the MIGS one and the clinical trials. It really gives a succinct overview about these two topics that are definitely going to be asked with you. Besides that, we have the AO1 network, also the WGA videos that are there, and the AIOS has a video play session. So you can go through all of those things. And then I focus. There are so many things nowadays that you can use. Whatever you find comfortable, whatever you find is easier for you to do, just make sure you cover everything. It doesn't matter which source you're studying from. As far as the investigations go, as I said, these are things that we are already doing in practice. We are doing perimetry, we're doing tonometry, gonioscopy. So you just need to know how to read these printouts, what the errors are like, what the exact numerical, how to assess progression, what is likely progression, what is probable progression. So all of those things on the GPA, the GDX, the older modalities of investigation also. So you have a look at all of those printouts and you have an idea about these things before your exam. So CyberSite, besides Iowa videos, is also a very good site to go through because it has different lectures on how to approach patients as well, clinical vignettes, as well as lectures on the evaluation techniques and how to discuss the investigations like perimetry. So that can actually help you as well. Surgical videos, you need to be thorough with your glaucoma filtering surgeries, be it adult or pediatric, what instruments are used there, your angle surgeries, all your mixed devices, valves, and any complication related to these. So as Dr. Vishnu was saying, that the things like iris cyst that they might ask you, as Dr. Mithun was saying, that there are different, whatever the whatever cases that they have compiled at their institute, those are the sort of questions that they'll be showing you. Then they might ask you surgical videos regarding those. So don't lose your head. It might be something out of these as well, but it'll be something that you've already read about or seen in practice. This is a AIOS scientific committee. They have a step-by-step surgical learning video seminars that are there, and you can actually go through these, and they're very nicely demonstrated videos. So you can have a look in case it's been a while since you've done your done these surgeries and you're giving the exam then. Besides that, just a general overview. When you're going for your exam, stay calm, be nicely dressed, be presentable, carry a lab coat because it's required. They've already mentioned it in your instructions. Greet your instructors when you meet them. Be calm, listen properly when you're being asked the Viva question, wait for them to finish the question, and thereafter, take a pause, think about the answer. Don't, ramble. Don't use extra words. Have an eye-to-eye contact. And, you should be facing them and your body language should be better. Answer these questions directly. If you don't know something, be honest and tell them that I can't recall so that you can move on to a next question, because ultimately there are multiple candidates and this is time-based. And this is not an exam that is for passing. They don't need to pass you for the must-know areas. These are exams that are for good-to-know areas. And so you should be able to answer. So let them ask you as many questions as possible. And also try and avoid short forms. for a specialty exam, it doesn't really matter so much. But if you can, try and say the full forms, for all your drugs as well. And at the end, just have fun. All the best.
Thank you so much, Doctor. That was a wonderful session. It was detailed, very well structured. I'm sure it has clarified many doubts for our young aspirants. Now, moving on to the panelists. Dr. Jaini, can you let us know how your preparations were for the practical exam?
Yeah, for the practical, actually, we were the same things actually we should revise first of all, because actually in our center, it was actually we had 20 questions as a OSCE initially. So this as an OSCE, it was again we should know much theory. It was 20 questions were 20 correct scenarios, and under the scenarios there were 4-5 sub questions and all. So again the theory we should revise again once, and then you should be ready. Then only be able to ready to answer those questions. So the first OSCE fully actually covered every glaucoma scenario was there. Again, a case of NVG was there. Again, a case of congenital glaucoma. Again, a case of pigment dispersion syndrome. So all those, they will give a patient coming with some signs and all. You should be able to identify first what is that. And the sub-questions were again, which we should revise when we read the theory. And again, also the practical, how, since we are, if we're practicing glaucoma, again, it will be more easier to understand those questions and answer them. Then again, after these 20 OSCE in our center, the other important thing is that also you should again research about your center before going for the exam, which is your center, and who are your examiners are actually will come there and all. You can know actually ahead, and you can try to know their interests and what are the procedures being done there more commonly. So in our center, actually, we had so many video clips were asked regarding this GDD and this mixed surgery. On those video clips and all, you should be familiar. So this has Dr. She has clearly said that so many videos are there available in the YouTube and the iFocus and all. You can go and revise those videos, which will help us to identify the video, and you can answer those video clips. Then again, the investigation, again, you should divide few days for the investigation per se, because an OCT image and HF image, UBM images can be asked, shown, and you should tell the diagnosis and how to proceed. What are the other, how to investigate further. So the investigation was one table. Again, the video clips were one section. And again, the drugs, the newer drugs were asked. So the newer drugs, mechanism of action and all. Like that, we also had the 4 stations were there. So I think we should, there's the videos and all are more important, the clinical videos, and again, the theory portion, you should read more. You should make it more thorough. And then you will all be able to get the exams easy. Thank you.
Thank you, Doctor. That was very well explained. Now, I would like to hear from Thomas Arun, sir, how it was for you, the practical session, how it was and how did you prepare?
Thank you, Dr. Shweta. Before I say, I would like to just congratulate Dr. Anima and Dr. Arshi. Absolutely fantastic presentations, and really, they've actually covered everything. So my theory was in Chennai, and the 3 people passed, and practical was in Mumbai Grand Hospital. The 2 of us, out of 3 passed, but only 2 of us came for the exam. And we actually had 10 OSCEs, and followed by actually cases. We had patients. We had about, I think, 4 patients. One was a pseudo exfoliation. One was a FAICO glaucoma. One was a patient who had a trabeculectomy, and the 4th I cannot remember. So basically, we had to see these patients, and then the Viva was actually based on the management of these patients plus a few other questions. So that was how the structure was. I think obviously it has changed now. Yeah. Thank you.
Okay.
Post-COVID, I think they have not been giving any patients per se to examine or for us to do any skills. It's mostly just question stems and your reasoning ability that they judge on.
Thank you.
Dr. Mithun, will you share your experience?
Yeah, thank you. So regarding practicals, like I would say, like we had, I think, almost 25 to 30 candidates in that year, and all were actually equally good. So I don't take any specific credit or anything. I would just thank my teachers for teaching me. So regarding the preparation, again, I would go with eye focus. The second thing is your practical knowledge. So that actually comes from your fellowship training and how academic you are. So I was actually involved in DNB training a lot. So I was pretty much aware of the recent trials and recent advances, what's happening in the field, because I was involved in the classes and all those things. So that might have helped me a bit actually. So because in OSCEs, I found it actually the OSCEs were pretty much easy for me because there were like 20 questions, but I think most of them were answerable. Like at least 90% would have been like straightforward questions. So I didn't feel any difficulty with the OSCE pattern. But when it came to the Viva OSCE, the actually came the importance of your practical knowledge. So Dr. Venkatesa was our examiner, and the first question which he shoot was like, what was the volume of viscose which you use? So that was kind of an unexpected question, and we were discussing, like all of us were coming out and discussing because we haven't, like most of us haven't used that personally. We know that we use viscose, but undergoing a training in a center where you are like restricted to all these things, so you just don't know actually how much is the volume. Yeah, obviously, if you're a good observer, you might be knowing that, but still the volume was something unexpected, and he was asking more on the lens-induced glaucoma part. So that was again unexpected. So that was the instrument session which sir was handling. So all of us were expecting questions on trabeculotomy and all those things. But the topic suddenly changed to how would you manage an intumescent cataract? Like, so it was more like a cataract YOOC. So this viscose question was something which was brilliant question, I would say, because that actually shows like you should be actually like how the current FAICO guidelines show, like you should have clinical experience in that specialty for 12 months or 18 months, whatever it is. That actually makes a difference at that point. But having said all these things, I personally don't think it is not something like how you go for a post-graduation exam or a DNB exam. Like Dr. Harshi has told, like it was more like you're interacting with some big names in the field, and you get little more visibility when you talk to these people. They also know you. It was more like an interaction rather than like you are going and sitting in front of an examiner. They are asking questions, you're answering. So it was more like discussing, telling them what you had when you had your training at your training institute. Then yes, I would agree with this point that you have to at least little bit research about the institute where you're going should be done, because the questions, the patterns, what is that institute famous for, the whole thing will actually focus on that part. But having said that, like again, like Dr. Ashi said, there will be other examiners also from other institutes. So basically, we had 4 sessions. One was for instruments, second one was for investigations, third one was for drugs and research, and fourth one was for surgery. So these were the 4 stations which we had. And the instruments, I would say this was the basic question for everyone. The same question was repeated for everyone, like how much was the volume of viscose by Venkatesh sir. Then investigations like OCT, UBM, and all those things are very important. But all those things are practical. Like you can actually tell the examiner like how you would actually see that patient when you're in a clinical practice, rather than telling like, okay, based on OCT, this patient has glaucoma. No, you can't say that. You have to do a structure function correlation should be done like for all those cases. And yes, research, like I said, I was actually a bit aware of the recent trials, and they do ask trials. And when you're able to answer like little more detail, like I'm not telling about the conclusion, but like how the methodology, how that trial was done, 2 arms, what were the arms, and if you're too good being an academic nerd, if you can tell the sample size, that definitely gives you an upper hand when it comes to uh, I'm talking about the medal aspect. But otherwise it was more like I don't think none of the examiners wanted to fail any specific person or anything. So it was more like an introduction. They just want to show us that okay, you know something now, there are more things to be learned. So this is like a continuous process. It was like more like a fun kind of a process, more like an interaction. And more than that, I would say like it was great to meet the other candidates. So when you go for the exam, you get this networking done a lot, because nowadays we have like 20-25 candidates. So when you come out, there will be people from different institutes. Your networking actually increases, like your contacts actually increase when you actually come out. So that was the experience which I had. So definitely, I would cherish that. So actually, that gives you two things. One, you feel confident that, okay, you know something. The other thing, you still feel that there is a lot more to learn. So like it's a continuous process. So yeah, that's my take home message. So just and general instructions like what Dr. Ashi told, that is very important. So more than the preparation you do, you have to be presentable. You have to just to make that eye contact, listen to what the examiner says, be calm, just be cool, and just try to say everything. Be true to yourself. Don't need to bluff, or you're not there to show that you know something extra or something. Just true to yourself. Then they are all very supportive. So that's my take on it. Thank you.
Thank you, doctor. Now we know how you were awarded the gold medal. So let's move on to Dr. Mainak. Would you share your experience, doctor?
Yeah, so I think Dr. Arshi has given a very nice presentation, and Dr. Arshi and Dr. Anima, both of them. So now that's going to be a resource tool for those who are going to prepare for the FAICO in the coming years. So in my case, I think one thing which Dr. Arshi has also pointed out, the general instruction that Dr. Mithun was also saying. So actually, in my time, because the FAICO, it was in Shankar Nethralaya, Chennai. So, and if it's in a very far off city, you should plan your travel also well in advance. I actually reached the exam slightly late than it, about 10 minutes late, and Dr. Tanuj Dada was kind enough to allow me to appear for the exam. So I would say that you should plan your travel very well in advance. If it's in a far off city, probably reach a day or night earlier, take a good rest, and so that you're well prepared for the exam, because it's a very time bound exam. We had like 10 OSCE stations and one grand viva, and we had a patient based station which is now not there, probably after the COVID times. But the rest of the format probably is slightly similar, although like my fellow appeared for it last year and she told me that the OSCE format has also undergone changes, probably because now the patient examination sessions are not there. So they had like, we had around 50% of the our stations which had one patient in whom you have to either do the disc evaluation or do the bleb assessment, something of the sort. So I think that is not there. And so I think also apart from the eye focus, post-COVID, one good thing is that most of these examiners would be from the academic institutions, and a lot of webinar and web material is available online nowadays. Their lectures and presentations on different topics related to like different types and like presentations of glaucoma. So I think if you go through that, that is also going to help you a lot in your preparation. And because overall, and you need to do your preparation for the theory and the practical simultaneously, because at least in our time, we had a very short notice period of probably 7-10 days. So once your results are out, you get a very short time to prepare for the practical exam. So as you decide to take on the exam, you should start your preparation side by side for both. So that's from my side. Thank you.
Thank you, doctor. And Dr. Vishnu, can you please let us know about your experience?
Basically, everybody has summarized what I have to say. Like everybody has given very structured, nice explanation. I think I already explained my experience. Like there were, I think Dr. Mithun sir was saying around like there were 4 stations. But I think from a station, like center to center, this variation, we had like 2 stations. And I think he already said that there like there was a portion regarding the drugs, then surgical instruments, and then the clinical scenarios. This is how it's actually divided. And more than your answer, I think it's your approach how they are asking. And initially, my experience, I was a little bit nervous actually. My first question was actually B scan of suprachoroidal hemorrhage with post trap, but I actually we never got a chance to see that. So first time when I was very nervous, and when I got the scan, I told it was suprachoroidal hemorrhage, but I was doubting myself whether it gave the answer rightly or not. And I was looking at the examiner's face to see any responses, but they actually kept a poker face, and I was not able to read that also. They were expecting more from me. How you manage? Then management, and when finally when I came out of the session after the exam, I actually went to madam and I asked, like, ma'am, was the regarding that B scan, was it correct? So she told me, yeah, it was correct only, but you should give more confidently. You should say it more confidently. So I think at this point also, when we are going for an exam, we still get that exam chills, or like we actually fumble in the first part. But after that, I actually got regarding the further questions. Those first 5 minutes was difficult, but after that, I think it was okay, and remaining questions were more or less okay. Then it went to that HFA, perimetry, then instruments. Then after that, it was a second station. They divided the topics more like drugs, recent advances like the implants, the sustained release implants, and more of a, I think, Mainak, Dr. Mainak was also saying you should follow the centers, the doctors who are in that center. They will have their own videos which you have to follow, surgical videos, and that actually helps. So, and a quick time revision is also I think theory part also helps with the practical, but yeah, regarding the networking, I met with two other doctors who were saying they all got different questions. One was asked regarding the YAC PA, how much energy you are giving, like specific targeted questions were giving, and why are you giving those that energy, and is there any studies correlating to that? These kind of questions were coming. So I think all of us were getting different questions. Not any of the questions were not repeating actually, except for the instruments. Other than that, questions were actually customer. I think they were. It's more like a discussion. They were asking, "What are you doing for this case? What are you doing? How you approach this case?" This was the kind of approach. Like, I don't know how to explain it, but it's more like a discussion. Yeah.
Thank you, doctor. Now, Dr. Anima, would you like to share your experience?
Actually, ma'am, my exam center was in Aravind Pondicherry. So, we had 20 ASCII questions. So, regarding the clinical scenario, we were given questions, and there were sub questions regarding pertaining to that. Then we had some questions related to biostatistics, like type 1 error, type 2 error, like not related to glaucoma, but but they were assessing whether we read up research articles, as Dr. Arshi ma'am had told. So that was there. Then we had this Viva's tables. There were four examiners. So mainly they covered the investigations, HFA, how to interpret, then OCT and the UBM images, ASOCT and UBM images, what the differences were. And also regarding the drugs and surgical videos also we were demonstrated, or like which they'll pause at a certain step and they will ask you what what step the surgery we are doing now. And also complications also, maybe bleb complications, they can put a video, bleb leak, all that, and ask questions pertaining to that. And that's.
Thank you. So basically, it's once you go to the practical examination, it's very basic things that they ask. For me, I had at RP Center, AIMS, and Tanujzada doctor was my examiner. He was asking very basic questions like if a patient of NTG comes, what do you do? What all investigations you do? And the other examiner was asking about trabeculectomy. And well said about you need to know your doctor who is coming for the examination, because Tanuj sir asked me about meditation and glaucoma. So you will have such kind of questions also. But if you have a basic knowledge in glaucoma, it's easy to crack the practicals. And about summing up about the theory part, you just stick on to 1 or 2 textbooks maximum, and then just add on. Like already our speakers have shared an elaborate detail, step-by-step guidance, and how to prepare. Both of you have done a very wonderful job. I'm sure all the aspirants are going to be benefited with today's webinar. And on behalf of organizers, I sincerely thank our esteemed speakers as well as panelists for your time and insights for participating in this webinar. This was a wonderful session and discussion. Thank you all for making it today.
Thank you so
Thank
much for
you.
the
Thank you.
opportunity and for having us. I would also want to thank my seniors and a lot of my glaucoma colleagues like Menak sir, Dr. Reenal, Dr. Prasanna sir. So they've been, they've been the ones who've guided us as well. And that's why we've been able to talk really lucidly here. Especially want to thank Dr. Reenal because she had a similar presentation and she guided me through this one as well.
Okay, thank you.
Thank you.
Thank you. Good night.
Thank you very much.
Thomas, good.
Good night.